So Marstacimab is monoclonal human antibodies that target tissue factor pathway inhibitor with the objective of increasing hemostasis by increasing thrombin generation, even if is without giving any factor 8 or 9 to our patients. So it's a rebalancing agent. The BASIS trial was the trial that studied Marstacimab in the large phase 3 cohort of patients to assess safety and efficacy of this treatment for patients with severe hemophilia A and B, and demonstrated superiority to previous on-demand therapy or routine factor prophylaxis in the observational phase compared to the active treatment phase. This is in the main primary analysis of the BASIS trial. What we are now presenting this year at ASH is the description of what these bleeds were look like, and in particular, we've seen that the majority of the bleeding episodes were treated with factor, about 80% in both groups. We've seen that the number of bleeds decreased over time in the active treatment phase with Marstacimab, so there were less bleeding episodes, as we showed before in the primary analysis of the trial. We've seen that most of the bleeds, as expected, again, were in the joints. About 70% were joint or joint muscle bleeds, 70 to 80% in both groups of patients. For the most part, they were spontaneous. The number of bleeds and the proportion of patients without bleed increased. The proportion of patients without bleed increased over time in the phase 3 study, in the main study, and the number of bleeding episodes, the total number of bleeding episodes, decreased over the course of the 6 months periods within the study. The other thing that of course confirmed what we've seen before is that there was a progressive increase in the proportion of patients either without bleeds or with a single bleed, and there was a decrease of in the proportion of patients that experienced more than 3 or more bleeding episodes in the study compared to the previous observational phase. Marstacimab is a subcutaneous option for patients, and in particular, I was mentioning hemophilia B because at the moment, hemophilia B in most countries, they don't have a subQ option for hemophilia B patients with or without inhibitors, and this product could offer efficacy and a good safety profile, and substantially reduce the burden of treatment for these patients. So I think in that regard, it's an advancement that we really welcome, and it's because it's a once a week subQ injection really relieves this obstacle of the IV infusions in our patients. So yeah, and for the specifically for the hemophilia B population, I think this is a very, very interesting and promising option. Yeah. Well, one thing that I think we need to take into account is that compared to other non-factor therapies, we've seen that, as I mentioned before, there was about 80% of treated bleeds. In some other studies, there was reported a lower number of a lower percentage of patients with treated bleeds in the active phase of the study, and this could reflect different decisions that made by the respective treaters, geographical differences, population differences. So highlights also a little bit of the variability that we can see in the different population that it's under study in the different trials at different times. And so it's a kind of a reminder that not all the studies are performed in the same population, sure, similar population in the sense that are all severe hemophilia patients for the most part, but their background characteristics, the status of the joint health, or other baseline characteristics of the study population can influence also the treatment or the decisions on the treatment of the bleeding episodes. I think, at least personally, I'm really looking forward to see the results of the extension phase of the Marstacimab, because it looked really promising when the data of the phase 3 trial were presented. We started to look at those patients that rolled over into the long-term extension phase of the study, but there was a small number of participants that reached that time point. So by now we should see that many other patients that actually rolled over into the extension phase. So I'm looking forward to see what are the results of the long-term extension phase and see what is the long-term efficacy and safety of Marstacimab for hemophilia patients, because it's a promising new potentially new product for our hemophilia patients. Hemophilia now is seen like a very rapid evolution in terms of the new therapies that might be available or are already available in some countries, and there's so much now that we can offer to our patients. I would say that all of these different new products have some specific characteristics, so there could be really space for personalization of the therapy beyond what we were used to in terms of just tailoring the same product to that patient. But now the personalization could reach another level, so giving the right medication at the right time for the right patient depending on their needs at that specific time. So Marstacimab covers also in particular a very specific need today, I think, in my opinion, at least for hemophilia B patients. But of course, as we've seen in the phase 3 trial, it could also be a promising option for hemophilia A patients. So each one of these new therapies could have a very specific space because of their very peculiar characteristics, mode of action, or in reducing the burden of the treatment for some patients, or because of the specific needs of some patients. So I think it's this evolution. I think it's very welcome for from both the treater's perspective and the patient's perspective.